Good afternoon, ladies and gentlemen. I am Dr. Yvonne Serrano Duque, and I'm the Senior Public Health Specialist of Asian Disaster Preparedness Center under the Health Risk Management Department. So this afternoon, I will be discussing with you module number 6, which is developing messages. At the end of this session, participants are able to understand the importance of developing key messages during emergencies, disasters, and disease outbreaks. Discuss the importance of getting the right message and getting the message right. Identify pertinent disaster risk information and aligning disaster risk communication plans through review of actual case studies. Formulate and integrate right messages into the disaster risk communication plans. Importance of risk communications in public health. Risk communication plays a critical role in preserving health, protecting dignity, and saving lives during emergencies, disasters, and disease outbreaks like COVID-19. It needs to be managed to minimize rumors, fake news, which often leads to create panic and distrust in affected communities, which impedes public health interventions. Timeliness is therefore critical to mitigate rumors and counter false information and fake news. Creating public health awareness brings about spurring action, understanding perceptions of communities affected, thereby bringing about behavior change and motivating people and communities for action. What do we mean by getting the right message and the message right? Getting the message right. Does it really matter? Why? 4 important questions to answer in planning for your communications. Number 1, who are the target audience and what do we want them to do? Number 2, what messages will move the audience to take the desired action? What will allow you to move and make an action on the messages? Who should deliver the messages? How and what materials are needed to support getting these messages out? Number 4, how will we know if we have succeeded in this strategy? So these are the things that you need to ask yourselves in order to, these are the very important questions to ask in planning for your communication plans. We have several tips for you, and number 1 is be focused. When describing your work, try to focus on the impact. Like for example, if you talk about children, then you may say we've treated 25,000 children for malnutrition, not we've treated 25,000 people for malnutrition. So that means you need to focus on your topic. If you talk about children, then your topic should be focused on children. Use quotes. Use quotes from children and photos of children as much as possible if your topic is on children. Help young audience see the world through their eyes. And because children love stories, use stories on how to help children. Number 3, you should be outspoken. Show the needs. Use strong words like appalling or unacceptable. Just don't overuse them. You need to inspire action. Make sure you have a strong call for action. Use words like now, today to express urgency. You should be proactive, meaning show ambition. We could be the first generation to stop children dying of preventable causes once and for all. That is a theme which goes proactively. Get excited about success and results. Something like, you did it. Your campaign helped inspire a historic deal on vaccines. A huge step towards saving the lives of 4 million children. You really need to show that you are excited on what you want to say. In doing such, we need to work on the so-called elevator speech. Has anybody of you done elevator speech? What is an elevator speech? So an elevator pitch or speech is a brief, persuasive speech that you use to spark interest on what your organization likes to say or does. You can use them to create interest in a project idea or product or in yourself. A good elevator pitch should last no longer than a short elevator ride of 20 to 30 seconds. Hence the name elevator pitch. Okay. One important thing that you should remember when we learn about elevator speech is that you, who would be assigned as a representative of your organization during health cluster meetings, technical working group meetings, during disasters, emergencies, or disease outbreaks. And when you attend this meeting, you will be given just a very short number of time to talk about your organization or what you are doing. So you take that example of working on an elevator pitch or speech so that when you present, you can say the right thing, you will be very succinct in what you say in those types of meetings. What are the principles of a good elevator pitch? Number one, the art of getting your message across effectively is a vital part of being a successful advocate. Develop clear, consistent, and effective messages that will provoke the audience to act. Your communication should seek to inform, persuade, or it should result in action. The difference between pitch and a presentation is the time element. A presentation generally takes more time to deliver. However, a pitch or elevator speech is a short summary used to quickly and simply define a project, a product, service, organization, or change a program. The name elevator pitch reflects the idea that it should be possible to deliver the summary in a time span of an elevator ride. Again, approximately 30 or 20 to 60 seconds. I might be giving you some examples of short an elevator speech. No? So I will give you 5 minutes to read this and tell me whether it's a good pitch or not a good pitch. Okay? Is this a good pitch? Yes, it is a good pitch. Let us look at this example. Is this a good pitch or a bad pitch? It's actually a bad pitch. So just take into consideration the tips that I have provided you earlier in developing your elevator pitch. 10 tips for developing a good written message. Number 1, know your audience. In the field where we work as humanitarian workers or development workers, leaders, we must know your audience. So the message that you bring about should be parallel to the audience that you are talking with or your target audience. Decide on the key message. What do you really want to say? Be clear on your objective. Organize your thoughts. Eliminate jargon acronyms and technical terms. Very good example is when you talk about we use a lot of jargons right now where people in the communities do not understand. We need to fix this jargon so that they would be able to understand them. Write simply, use short words and sentences, be concise, benefits, not features, use quotes, that's very effective, and use reliable sources. Okay, so as we move forward, I have several case studies for you, and we have provided you handouts the other night so that you can review them. We were able to divide this according to each of you was given an assignment. So I hope that we will be able to discuss this today and what are the important things that you need to put into your communications plan. These case studies, however, are divided into three. Number one, general, of which we talk about humanitarian, direct impact on conflict, insecurity, policy, travel authorizations, and internet shutdowns. On B, case study B, we talk about clusters, sector-specific, protection, health, wash, education, food and nutrition, shelter, and non-food items. And then on C, we work on cross-cutting themes such as stigma, women, and gender-based violence, as well as child protection. The case studies that we have provided you are actual and recent cases. Some information have been changed for the purpose of learning. For the general message, what is the message that you got from this information? We have a country called Atoka, and we have several communities like Pikpak-Boom and several others. And you would need to decipher what are the general messages that you need to do. So the messages that we need to work on the general information are the following. While responding to this crisis, a right balance must be struck between efforts to fight COVID-19 and maintaining support to the most marginalized group, including the poor people trapped in humanitarian crises or pandemics or disasters, and those driven out of their homes. People with chronic diseases and with disabilities are very important. Measures to prevent, prepare, and respond to the COVID-19 pandemic must include everyone regardless of race, religion, and of skin and social and civil status. It is of extreme importance that protection and human rights, as well as public health perspective of everyone, is equally part of all pandemic operations. Number 2. On the humanitarian context, what messages can you deliver or take out of this? Humanitarian context. COVID-19 does not discriminate nor does it recognize borders. Efforts to prevent, prepare, and respond must not discriminate either. People in need of humanitarian assistance, internally displaced people, and other vulnerable groups such as persons with disabilities, prisoners, and others must have equal access to information and assistance. Impediments on freedom of movement that has exacerbated people challenges must urgently be simplified and lifted to allow safe and sustained access to healthcare and essential services. Very bad. How about direct impact on conflict? Direct impact on conflict. We know very well that when there is conflict, like the things that's happening around us, which is very volatile, the United Nations Secretary General, in this case, called on warring parties to silence the guns, stop the artillery, and the airstrikes and fight against common enemy, which is COVID-19. Active violence in boom and hail provinces does all but help fight this battle. Attacks against civilian infrastructure can and will have devastating impact on abilities to respond to the deadly threat of the pandemic. Violence and deadly explosive hazards will limit people's ability to access information and seek health care and deepen their vulnerability. Parties to the conflict must lay down arms immediately and focus together on measures to tackle the spread of the pandemic. Let's go on the third topic, which is insecurity. Some of the messages that you need to consider in terms of insecurity are the following. Humanitarian programs play a significant role in slowing down the spread of diseases. The delivery of aid like soap, clean water, and hygiene kits, or information about the risk can prevent the spread of the virus in vulnerable communities and displaced camps or IDPs. COVID-19 requires the world to come together stronger than ever and mount a unified and committed response that is simply not possible otherwise. All parties to the conflict must urgently cease hostilities and establish a humanitarian passage for national and international organizations so that they can support even the most remote communities. This should be done in coordination with government to reach the most vulnerable communities in need with vital information, preparedness, and assistance. Number 4, how about on policies? Here are some on the messages that you can develop on policies. The humanitarian community commends the robust efforts of the government to prevent and contain the virus, including by limiting movement and imposing lockdowns. Given the vulnerability of conflict-affected communities or even disaster-affected communities and people displaced in camps and sites or refugee camps, it is necessary that these measures be adjusted and circumstances and living conditions of these displaced populations are taken into account. Number 2, it is vital that humanitarian programming, risk communication, prevention, and response efforts to potential COVID-19 outbreak in camps and displaced sites continue and are scaled up. The humanitarian community and other organizations is committed to continue programs that support the people with due consideration of their welfare, well-being of both themselves as well as the people they serve. So that means it's not only the people that we support, but also ourselves. Frontliners are important to be supported, to be able to help others as well. about on travel authorizations? Messages on travel authorization. Safe, inclusive, and unfettered access to all people in need is a prerequisite for an effective, principled, and timely action to inform of risk, prevent, and contain the outbreak among the most vulnerable communities and displaced populations. The travel authorization procedures that are time-sensitive, predictable, and effective in all conflict-affected areas remains essential, both for ongoing humanitarian operations as well as for the efforts to jointly tackle the COVID-19 outbreak. How about messages on internet shutdown? Access to information is a basic human right. In this difficult time of the spread of COVID-19, internet shutdown can result in devastating consequences for the people affected and internally displaced. These communities are deprived of vital information they urgently need to protect themselves. Kotoka must lift all restrictions on mobile communication and access to internet in all affected townships to ensure that the environment allows for the delivery of medical support and clear communications to all communities at risk. Let's now go to case studies number 2. For this case studies, we will talk about the specific clusters, the sector-specific groups that you would be attending, such as protection, health, WASH, education, food and nutrition, shelter, and non-food items. So again, you were provided assignments on this, and let us see how you worked well, or how did you develop messages out of the assignments that was provided to you. Just to recap, on protection, protection messages. Number 1, everyone, regardless of documentation, status, gender, disability, ethnicity, religion, or language, must be able to receive life-saving testing and treatment in a timely manner. It is critical to ensure the accessibility, availability, and quality of healthcare facilities, goods and services to everyone, including IDPs, and those living in non-government controlled areas. Camp and camp-like settings should be recognized as among the community spaces most at risk of facilitating infection. It is therefore essential that resources to support should be monitored, upgraded, and improved as needed. Displaced, stateless, and conflict-affected people and communities should be included in community-level coordination structures designed to support preparedness and response to the outbreak. This is to ensure that their specific needs are addressed in relevant planning. Very important to consider is the dignity of the patients tested, especially those who are positive, in a manner that will be respected particularly their identities, and should protect at all times without exposing too much unnecessary personal information. Why? Because this could lead to stigma. Next topic. What are the messages that we need to prepare or think about when we talk about health? Message number 1. Everyone must do all they can to protect the health and humanitarian supply chains so that the frontline workers are protected and are able to travel safely as they give life-saving care. Supply of food, basic medical equipment, and other emergency items, as well as the transfer of humanitarian personnel, must be ensured at all times. Safe and inclusive access to people is even more important than ever under these current circumstances. Humanitarian spaces must be maintained at all costs. Ensuring free movement of essential health products is vital for saving lives and curbing the social and economic impacts of COVID-19. While movement restrictions and certain lockdown measures may be in place in effort to prevent and contain the virus, these measures must not jeopardize people's access to vital information, healthcare, and other preventive measures such as water, sanitation and hygiene, support and welfare of all people. It is also important to ensure that people are informed about the intended duration of such measures. Testing, tracking, isolation, and responding to COVID-19 pandemic must not discriminate and must be undertaken with human rights perspectives. Human programs or humanitarian programs that are essential to decrease people's exposure and vulnerability to the risk of COVID-19 must continue and must be scaled up in all conflict or disaster-affected areas and displacement sites. Let's go to the next topic, which is WASH. What are the important things that we need to remember or messages that we need to think about when we talk about WASH, or water, sanitation, and hygiene? Wash, water, sanitation, and hygiene. Message number 1, hand hygiene is one of the most effective measures to prevent the spread of COVID-19. However, this is a practical challenge for those who lack access to clean water or who live in cramped conditions in the conflict-affected areas in these countries or communities. It is therefore a practical challenge for those who lack access to clean water or who lived in cramped conditions in conflict-affected areas in this country. Internally displaced people, those who are living in overcrowded shelters and communities in conflict-affected areas, or those who are affected with disasters must have safe and unhindered access to clean water and sanitation facilities all the time. Free of charge to public hand hygiene sanitations and improved access to hand hygiene facilities and practices should be provided to these people, and they should be prioritized, as access to water and sanitizers are very important in minimizing the spread of COVID-19. You can just change, okay? Along with the nationwide response, the specific and extreme needs of vulnerable communities and internally displaced people in camps must be taken into account in the planning and implementation of any COVID-19 related response efforts. Access to clean water is a significant challenge for many internally displaced people in camps and communities where there are active conflict. Landmine contamination or restrictions on freedom of movement have also greatly contributed to the limited availability of drinking water. Meanwhile, available resources are drying up due to the hot season. Parties within the conflict must do all their power to stop hostilities and ensure freedom of movement and enable safe and sustained access to clean water for all communities affected and internally displaced people. Let's go on education. What are some of the most important messages that you need to work on when you talk about education? In times when access to accurate information is vital to prevent and spread the virus, learning processes in camps and communities affected must not be halted, but rather adapted to necessary learning modalities, including distant learning and ensuring social distancing if you have to do face-to-face. Internet shutdown in 8 townships of Halle and Boom provinces is having a detrimental impact on the abilities to reach all girls and boys with accurate information about the risk of COVID-19. So it is therefore necessary that preventive measures must urgently be restored. Children are the hidden victims of this pandemic. Short and long-term impacts on their health and well-being, as well as their development and prospect, is a concern. Thousands of children have been uprooted and we know very well that these are living in extreme poverty. Therefore, they would be running out of essential vaccines and services. The need for support has never been much greater now that we have COVID-19. Despite official closure of schools and education activities, including camps and camp-like settings in conflict-affected areas, this must be a particular focus, particularly on risk communications and awareness raising. These closures are not only limiting the access of learning, but to school nutrition, health programs, clean water, and accurate information about COVID-19. Whenever necessary, alternative learning programs and opportunities must be made so that children must continue going on through their class either on different mediums such as radio and TV programs. This must be enabled. The humanitarian community commends the efforts of the government to contain the virus in this country, including by scaling up the quarantine measures. However, it reiterates that schools and education facilities must not be used as quarantine facilities. Humanitarian community remains committed to the work with the government and identify and find the right isolation facility and thereby support necessary response measures in line with humanitarian protection principles. Now let's go to food and nutrition. Safe and uninterrupted food security and nutrition interventions in camps will improve the immediate food security and nutritional well-being of people displaced and affected. This is mainly by tackling the causes of malnutrition, thereby reducing the exposure to risk of COVID-19. We know very well that when people are malnourished, it is easier for them to be infected and affected with COVID-19. There is a clear link between nutrition and public health. Communicable diseases brought on in part by malnutrition are responsible for further deaths. Change. There is a clear link between nutrition and public health, as well as communicable diseases. Malnutrition is responsible for further deaths, particularly in COVID-19. Safe and inclusive and, again, unfettered access to food by all people in need is a prerequisite for an effective, principled, and timely risk information, and thereby important in the prevention and containment of the outbreak among the most vulnerable communities and displacement sites or camps. Parties to the conflict must urgently cease hostilities and allow humanitarian persons to access with limited supply chains of food and use transportation routes to deliver the necessary food to rural and most remote areas. Shelter or NFIs, or non-food items. What messages can we develop out of this? Okay. The living conditions of internally displaced people in camps must be considered when preparing or establishing isolation facilities. Freedom of movement restrictions must be urgently lifted to allow internally displaced persons in the camps to seek for treatment outside the camp without any discrimination or stigma. Decisions on isolation must be health-led and medically informed. Health professionals must be reminded of the ethics of their profession and ensure that everyone receives the same quality of care without discrimination on the basis of color of skin, religion, ethnic background, and social and civil status. No one must be denied of treatment and care. The humanitarian community commends the efforts of the government to contain the virus, including scaling up of quarantine measures. However, it continuously reiterates that education and other facilities essential for the daily activities of internally displaced people in the camps must not be used as quarantine facilities. The humanitarian community remains committed to working with the government to identify and find the right isolation facility and support necessary measures in line with humanitarian and human rights and protection perspectives. Case studies Number 3. So this gets along the cross-cutting themes, which are stigma, women and gender-based violence, and child protection. In the face of COVID-19 crisis, we are all vulnerable. The virus has shown that it does not discriminate anyone. Thereby, many refugees, those forcibly displaced, the stateless, migrants are all heightened at risk. The government of Atoka and communities must do all they can to protect the rights and health of everyone. Protecting the rights and the health of all people will in fact help control the spread of COVID-19. Coronavirus does not discriminate, neither does it recognize borders. Anyone can be equally affected regardless of place of residence, color of skin, religious beliefs, ethnicity, and even social and civil status. Disinformation and stigmatization can cost lives. Governments and humanitarian organizations, therefore, needs to ensure that everyone, including displaced persons, vulnerable populations, have access to correct information and health information. On women and gender-based violence. Gender-based violence in all forms, including domestic violence, will increase during an emergency. The most vulnerable people, including marginalized, stateless groups, other minority communities, children and women, will likely face increasing threats to their safety and well-being. This includes mistreatment, gender-based violence, exploitation, social exclusion, and even separation from caregivers. Because of these actions, they need to contain the spread of COVID-19 pandemic. Experience shows us that public health crisis deepens gender inequalities with devastating impacts on girls and women. And too often, the gender impacts of disease outbreaks are ignored. Efforts to prevent and respond to the COVID-19 outbreak must be inclusive and must do no harm, particularly to the most vulnerable groups, including women and children. With responding to COVID-19, the government and humanitarian community must ensure that hotlines and services for all victims of domestic violence are considered as essential services and are therefore kept open, and law enforcement is sensitized to the need and are responsive to calls from victims. On child protection, children are often the victims of this pandemic. Short and long-term impacts of their health and well-being, their development, and their prospects may be devastating. Prevention and response efforts must take into account their specific vulnerability. In times where there is an active conflict, coupled with potential outbreak of COVID-19, children are at heightened risk of violence, exploitation, and abuse. More so when schools are closed and jobs are lost, and even when movement is restricted. Of particular concern are children on the move or living through active violence. For them, the consequences of this pandemic will be unlike anything that we have seen. Children in the conflict-affected areas and in displacement camps live in overcrowded conditions with limited or non-existent access to health care. This, therefore, makes it more difficult for children. Children and young people may miss out on some of the best moments of their young lives, such as chatting with friends, participating in class, and enjoying sports. This increases anxiety and can provide behavior changes among children and young adults. Now, you have identified specific initiatives that needs to be included in developing or in strengthening your disaster risk communication plans. Review your DRC plans. Compare it with the pertinent messages in our case studies. Make sure you have pertinent messages that you need depending on the condition that you are in, such as emergencies, disasters, disease outbreaks, or even in complex emergencies. As we all say, there is no one size fits all. And what is very important here is taking a lot of information from the things that we have learned in this session, try to see how this can strengthen your communication plan, of which we will do again, or we will review in the next modules. For this session, we give you another 30 minutes to work on. Okay. After this session, we would like to know whether you have we understood the importance of developing key messages during emergencies, disasters, and disease outbreaks, or even during complex emergencies. Number 2, have we discussed the importance of getting the right message and getting the message right? Have we identified pertinent disaster risk information and aligned DRC plans through review of actual case studies? So with this, I hope you have learned something, and we thank you. Important facts: you don't manage the truth, you tell the truth. That's from John M. Barry, The Great Influenza, the story of the deadliest pandemic in history. Again, thank you, ladies and gentlemen, and I hope you learned a lot in this session. Thank you.